Welcome to What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro, and today we have a very special guest, one of our very own, Farah Zipursky. Thanks so much for being here. We have a lot of history, so we got a lot of stuff that we can cover and talk about with everyone.
Thank you for having me.
So tell us how you got into the whole health field, because we all have our story, and that's the most important place for us to start.
Yeah, so I got into the health world. I was living abroad in Australia, and health was never something that I was really interested in or cared that much about. But I moved to Australia and it kind of opened my mind to healthy eating, kind of eating whole foods. And immediately when I was living there in the sun and, grounding every day before I even knew that that was a thing, being on the beach, and just eating really healthy and taking care of my body, working out avidly and being outside in the sun, etc., I noticed instantly how much better I felt. And I was like, my mind was open up to that. And I just really realized that not that I was feeling bad my whole life, but just how I wasn't taking care of my body. I was like drinking and partying in university. And then when I moved there, it was just like, it just clicked to me like, wow, this is amazing. And so I got into nutrition. And when I moved back home, I decided I was kind of unsure what to do. And, I was talking to my dad and he was like, well, Farah, why don't you take a nutrition course and be a nutritionist? And I was like, absolutely. It just clicked to me. So I did. I did a nutrition course. And again, my mind was open up to that world. But what I noticed that I loved most about the nutrition course was when we spoke about chronic health issues and how to heal them through food or other natural ways. And that's what I really was interested in. And then when that was done, I was working, kind of at different clinics or doing some personal stuff myself. And then I decided that I wanted to continue learning and do functional medicine. Around that time, I started feeling a little bit worse. I think when I came home from Australia, it was really tough for me. And firstly, I lost my period. So that was the first sign of it. And then slowly after that, I started getting really constipated and I was not going to the bathroom at all. But meanwhile, I was still doing the nutrition course and really unsure what was going on, but learning a little bit in the nutrition course of things to do. Then, yeah, around that time, my sister was working on a movie, Suicide Squad, with a lot of pretty big names. And she had mentioned to me that there was a chiropractor and functional medicine doctor on the movie that was also treating some people by the name of Dr. Steph. And um, I said, okay, I'm going to reach out to her and maybe she can treat me and see what's going on. And then, yeah, that's when I met you.
Yeah, we met but I never knew that about your story about in Australia. That's where it all kind of came to. And then you come here though, and then you don't get as much grounding and your body
Right.
gets used to having these extra photons and all of these other things that help make us
Mhm.
healthy that we lack here, right?
Yeah.
So even like that's why we start to incorporate biohacks. But yeah, no, so we met and you were going through your struggles, but you were also finishing school, right? When we were
Right. Yeah.
meeting.
Yeah. But again, I was just coming to you for treatment. And then I think we did do a little bit of a functional medicine portion,
Yeah, we did.
not just physical stuff. We were doing the actual functional medicine.
And it helped for a bit, but you had some really chronic stuff going on. And
Right.
like, I think some things uncovered after the years, right? Like,
For
of
sure. For sure.
what it was. Yeah.
Yeah. I mean, I would say that the constipation was getting really bad. I was not going for days. And I ended up, which I think looking back ended up really screwing me over, messing me up, was because I was getting really addicted to the colonics and I was going 3 times, 4 times a week. And then I was also doing it at home.
Yeah.
So I was buying the bags and doing
Mhm.
them at home. And then I was doing the coffee enemas, which I remember the first time you told me to do one, it was like magic. It worked so well. And yeah, you get addicted to this stuff, and it's like the only way really to go.
Well, we kind of lose that reflex. And that's when we started, remember at one point, focusing on your brain, like it was pituitary stuff that helped you go naturally, right?
Right.
Remember at that point? And
Well,
like,
I
I can't,
remember, so at that time, my partner had a prescription to
oh
Adderall,
no, I remember.
and
Yeah.
I was telling you that it was the only thing that would help me go. And that's when you were like, oh, it must be a brain thing because
Mhm.
it the second I took it, obviously the drug itself is like completely for your brain and whatever it does to speed
Yeah.
that stuff up. And I was on that for a while, and that's when I realized that it was masking all my other symptoms because
Mhm.
the Adderall brain focused makes you feel alert. It makes you wake up and feel awake, not tired
Mhm.
during the day. It doesn't make you feel cloudy, brain fog. So I was addicted to that and it was really helping me for a while. So my symptoms were masked for a while. But again, if I stopped taking the Adderall, I wasn't going to the bathroom.
Mhm.
And when you don't go to the bathroom, of course, we know how bad that is for your body.
Yeah, you're recirculating toxins, like,
Of course.
you need to get that out. You
Yeah.
recirculate a lot of things that need to be evacuating. It's a very
Yeah.
important part of detox. Yeah.
Mhm.
Well, when did the Adderall or Vyvanse like stop working for you at some point?
Yes, I would say that I got completely immune to it. I mean, I
Yeah.
wasn't doing what it used to. And then I guess after a while, when I maybe stopped taking it, I don't know, over the years, things were just status quo, but again, still struggling with everything. This was now in 2022. Yeah, 2022 or 2021. I went on a skiing trip, and when I came back from the skiing trip, I had like really bad ear pain when I landed, and I thought maybe it was an I haven't had an ear infection in years. I thought maybe it was
Yeah.
an ear infection. And then the next day I woke up, I remember putting lip chap on and pressing my lips together and I couldn't do it.
Mhm.
And then I look in the mirror and I could see that I couldn't close my left eye.
Mhm.
And I was like, what the heck is going on? I went to the hospital and they told me I had Bell's palsy and it was severe.
Mhm.
And so this was during COVID. I had a feeling I did get a vaccine and I had a feeling it was related to that.
Mhm.
I
It is
wasn't
one of the listed side effects of it. And
right.
but like what I talked about even in the last thing and everything I went through, a lot has been triggered by COVID in general. And then when you do the vaccine, it has the spike protein in it, so it can
Right.
turn on the same things, right?
Right.
So sorry, go on.
Yeah. And of course, they said just take some steroids and it'll be basically like it'll take maybe some days it takes, sometimes it takes 5 days, sometimes it can take a few months to heal. And of course, it didn't. It was absolutely awful. It really was so bad.
Yeah.
I was going all over the place. I was going to get acupuncture in my face. I was just trying everything physio, taking B12 shots because, of course, our nerves need B.
I don't think I was in town when this was going through because I left all during COVID.
Right. Yeah. And I honestly didn't know what to do. I was getting like daily IVs at a point just to do anything and everything to try and help it. And I think I saw a functional medicine doctor. We were kind of like back and forth with seeing each other, me and
Yeah.
texting sometimes, but I saw a functional medicine doctor in Toronto and he said to me that he works with this doctor who does stem cell
Stem
therapy.
cells. Yes.
And I was like, okay, let's do it.
Mhm.
Anything. So they took my bone marrow and then they injected in my face. And which they said, within 3 weeks, you should start having movement. And up until then, this happened, first time I got it was in the end of January. I got the stem cell treatment in April. So by May, like by beginning of May is when I could start moving my face again. And
And this
that
was
was really
2021,
scary.
May 2021.
Yeah, May 2021. So
Okay.
that was really scary. I don't know if anyone has had Bell's palsy and they like know what it's like, but it's not just the fact that okay, my face is completely numb and I can't move it. Your entire sensories change. Any loud noise is painful. Your entire left face, like even if I press it really hard now, I still feel pain. The
Mhm.
amount of pain that I was feeling too from it was extraordinary. It was awful. And then I had to sleep with an eye patch every night because my eye wouldn't close.
Mhm.
And then of course you're like, embarrassed and humiliated by the way you look. So that was also really mentally difficult. Yeah, and then I guess after that it started moving, I was like pretty happy, but then I decided to look deeper into this and see what else is going on in my body because it had been 4 to 5 years where I've been feeling pretty bad. So we did the Lyme test and it was positive, and that's when we really started working together. Sorry, backtracking. I actually remember speaking to right after I had Bell's palsy and us talking about actually working for you and helping patients that are
Yeah.
dealing with the same sort of
Yes.
thing. So I started working for you at that point. Yeah. And then about a year later, the Lyme was still pretty bad and we were trying to work through things and things were getting better. Again, I spoke to my parents about it and they had spoken to someone who went to this clinic in Mexico, Genevieve. and how they have had amazing success with Lyme patients and chronic illness. And I was like, okay, if there's a cheat sheet in terms of getting things better,
Faster.
like let's do
Yeah.
it. Yeah, exactly, faster. And so I went and I spent about a month there. Did, of course, they did do antibiotic IVs. We did do, which was their biggest thing for Lyme, was the cryotherapy. What's it called? When you like go in the oven.
Oh, the hyperthermia.
Hypothermia, thank you.
Hyper.
Hyper, yeah.
Yeah.
So that
How you
was,
go
I
in the
think,
oven.
literally you cook in an oven and it takes like 5 hours, which is crazy. So you're out for 5 hours. And then we ended off doing whole body stem cells as well. So that was through IVs. And during that
Oh,
time, when
wait,
I look back,
was that umbilical
yeah,
stem cells that time? Yeah.
yeah. But it wasn't like the first time was directly in my face. This
Yeah.
was through an IV, so it just goes everywhere through your body. When I look back on that time, I was so sick. Like photos of myself and just thinking about the way I felt, I was so sick. And then I'd say maybe a few months after Santa Vive is when I started feeling pretty good again. It took some time, but definitely feeling good
Yeah,
again.
we did some other stuff and then you tried other therapies. Like it's honestly, if we had a one size fits all for Lyme, like some people respond just to like herbs and treatments at home. Like I had to do a lot of extra things that, moved the needle. So, but we in our programs just try to be a quarterback to guide you to the things that actually work and help,
Yeah.
right? Like so sometimes we've had other people have great that can afford things like centers like Sanoviv or even Lyme disease Mexico go there and yeah, they focus a lot on multiple therapies, like not just the IV antibiotics, but they do those also there. And I did oral antibiotics and they definitely moved the needle when I was really acute, but we know that they don't do much in general for really chronic cases of Lyme, like
Mm-hmm.
especially the oral ones. Sometimes the IV helps more, but it's such like a multi-system issues that happen that there's like so much immune dysregulation, and that's what I've really started to see. And especially because I did the gold IV was the thing that really helped me, and you're talking about your hyperthermia, and it put me into the highest fever that I've had. I was not able to naturally have a fever with any sickness I had, including when I felt like I had a fever. I didn't actually have one. And
Mm-hmm.
the heating up of your body kills a lot of these pathogens. So one of the things before all of this turned on for me again, as far as Lyme, was I was like, "Oh, I haven't been sick in 10 years. Like I haven't caught a cold, I haven't had a flu." But really, instead of like mounting the big response against pathogens, they were all just in my body, never being fully cleared. And I saw that on a live blood cell. So for me, when I went for the IV that had gold and platinum and all of that, and it turned on my immune system and I got the highest fever, I had like meningitis symptoms. And then I'm like 90% better of the leftover symptoms I had. I was much better than I was before. But
Yeah.
it's that whole thing like where we need that big response. Like our body is not clearing those pathogens and they're just building up, and our immune system's just overworked and not clearing anything. And then
Yeah.
that leads to the inflammation. And then stuff gets into the nerves. I had Bell's palsy. Luckily, mine was one that kind of cleared up over five,
Right.
6 days. But then that's when I got diagnosed with multiple sclerosis, which it
Right.
wasn't, right? I had toxoplasma for all these years. That was in 2010. I put everything into remission based on just a parasite cleanse, right? My body was younger. We weren't inundated with COVID, all the 5G EMF that our body has to deal with, all the tons of chemicals they've even come up with since then, right? So we're
Yeah.
all seeing, like yourself, just this overload, and then something is the straw that breaks the camel's back.
Yeah, that's interesting that you said about you not getting sick for a long time before all this happened, because that was the same with me. I had, as a child, you have strep, you have, classic sicknesses that go around every year. But I would say 5 years before it all went bad, I hadn't gotten sick in years. And I was like, oh, my body is so
So
healthy. This is,
strong.
of course, nutrition, but it wasn't like that's not normal. So that is really interesting. And also, when you just said about like how different treatments help different people and depends on what works for them, I also think because Lyme is so unknown and there's still so much of it that we don't know about it, it affects people in different ways. So mine was like completely brain based. I mean, I know a
Neurological.
lot of people's are, but a lot of people have um, chronic pain in their joints, and
I had
and
that.
that was like you, yeah, that wasn't a big thing for me. It wasn't the chronic pain in my
Yeah.
joints. I mean, I had back pain, which is why I
Mhm.
originally came to you, but that
Mhm.
was from like a sea doing accident. But I would say that the pain lingered because, and it hasn't been, cleared yet at that point because of probably the Lyme that was still stuck in my body. And
Well, a big thing for me was like this aha moment when I also did the gold IV and I had like my spine went into spasm. And a big thing for me was my neck would always kink, right? And we know Lyme and toxoplasma and all that, they live in the cerebral spinal fluid in the brain. So, not that it was an aha that I don't know it's there, but like how much better that was after I felt the symptoms where my body was killing the stuff. And then, I don't have those symptoms anymore.
yeah,
Like just showing it was pathogenic, like people would look at it and be like, oh, it's degeneration, it's this, if it's just someone's spine. But sometimes you have a weakness in your spine because, yeah, you got in a sea accident years ago, but really these pathogens re-inflame everything too.
mhm,
So like those are things that I think people miss. And even in my early years as a chiro, like, you're not taught that. And like even the organ pain, because I had the organ pain and mine went to the heart this time. Like when I first got it, it was more like typical Lyme, like Bell's palsy. Like I had the anxiety, sense of impending doom. I had some of the gastrointestinal stuff, and like I was had severe vertigo and stuff like that this time. But I didn't have any heart involvement then, and I think that's where kind of COVID comes in with the whole myocarditis and all of that stuff. Because this went straight to my heart. It turned back on the Lyme that I didn't really know I had in 2010, and it went straight for my heart. So, but then they put a wireless heart monitor on me. And this is where I tied in all the electricity stuff because I was
mhm,
also in Las Vegas.
right,
So they put a wireless heart monitor on me. And they even said to me, people have been saying this is making them feel pain in their chest, but it's impossible. But
right,
your heart's electric. And now you have Bluetooth running
right.
through your body through a phone. My hair started going on, standing on end. And at first I was just high blood pressure, heart pain. But after that, they put that thing on me and my body short circuited and broke their machine. I started getting kidney pain, liver pain, all my joints started hurting. So it went from like a concentrated area to systemic after I
Really?
had that. I went from bad to worse. I could have been better probably within a few weeks, like, or
Mm,
at least like instead of the years that it took once it entered my liver and
yeah,
kidneys and
yeah,
everything. Like, so, it's like
yeah,
that's the electricity component that like and you just got off a plane that day, even though like there's like the plethora of
yeah.
things that like all
And
come
that's the
together.
thing is we're sometimes our own test dummies in terms of figuring out, okay, this made it so much worse or that made it so much worse. Like to
Mhm.
be honest, when I look back at the time that I was at Sanoviv and I remember how I felt and I look at photos of myself and I was not just swollen. I mean, I was swollen, but
Yeah.
like I was also 50 pounds heavier
Yeah.
and I had no hair. All of my hair had fallen out. And you would look at that and you'd say, but why? You were in treatment and it was, but you have to get sometimes worse before you get better. And
Yeah.
whether
Detox
it's,
is hard.
yeah, it's so hard. And I mean, it's like I just said, you're not sure what's going to work and what's not going to work. And when they put that heart monitor on you, obviously that made things so much worse for you, but that's what they thought was going to be the best thing for you.
Yeah,
So
but I
yeah,
just don't think people ask enough questions. And like she
right.
actually said to me, people are saying this is hurting them. Why don't we listen to people? That's what I get from all of this. It's like,
Yeah.
people aren't making stuff up. We always want to like force people into like malingerer category. Like people are
Mhm.
suffering with weird, weird symptoms and we have to start listening to them. Like
Yeah.
we have experienced weird symptoms so we can be empathic with our patients. Like we've been there, right? Like
Mhm.
we know the struggles. Like we know it's not easy getting through these issues, but they're still real. There's still something causing it. It's not in your head. It's not anxiety. It's literal pathogens, stealth infections. I think more people have to get educated on right now because it is just so poorly handled. And some of the best results I've had with people that are having big problems is like, for instance, one lady, I don't know if you were the health coach for it. I think it was, I don't know, but she had like severe candida that was the natural was not enough. Like it was fungus was growing in her ears, right? She had mold pockets on her lungs. And she just happened to, thank God, have this rheumatologist that understood infection and did the diflucan and nystatin. And that combined with opening up her pathways and like then we really moved the needle for that person. I'm not saying everyone needs that, but like
Yeah.
there's a time and a place for everything. And we have to start communicating better with different practitioners and different levels
Sure.
of or different types of education, right? Like
Yeah,
you can get the best outcome in this when you're, first of all, open-minded, second of
mhm,
all, and also feeling like your intuition about what is good for you, right?
for sure.
Like
Sure. Yeah,
so
huge.
so there's multiple ways to get better,
Yeah.
right?
Yeah. And I am hopeful that, I mean, I don't know if it's going to happen anytime soon, but I am hopeful, and I have some friends who are doctors that work in hospitals, and they are telling me that, they're putting certain things in hospitals now, like the oxygen hyperbaric tank in some hospitals, they're
Yeah.
using that. And I'm hopeful that maybe they will see that, okay, the functional side of it and the naturopathic side of it and the homeopathic side of it isn't actually woo woo, and it actually is working for all these people
Oh my
that are
gosh.
coming in with crazy
Yeah.
symptoms and illnesses. I mean, it's not
So
normal
much.
that everyone's getting diagnosed with MS. It's not normal
No.
that people are feeling this way.
Yeah, and so much I thought was woo-woo before I went into
Yeah.
like I was like homeopath, I don't get it. Like cures like until like the severe mold I had in my nose went away immediately with an LDI after like a year of like trying to clear out all this gunk that just kept coming back
Mhm.
and taking all of the things like I did, everything for it and it was like wow, like it was like that aha moment and then, these things haven't been around thousands of years because they're not working, but we
Yeah,
just have lost all of the knowledge and tradition of how to use them and when to use them and
for
when
sure.
to turn to those things first before we go to things that, can help us get out of dire situations, but then have their own fallbacks after, right? Like
Yeah.
being on antibiotics for too long or just in general, how it affects your gut microbiome and, like, and speaking of the gut microbiome, and I'm getting more and more educated on it, and obviously it's being studied more and more. But I mean, we have all these toxins. We're testing people's urine and we see they're riddled with toxins these days, right? But every toxin, there's a bug that could break it down for us if we had it in our gut. Like and just like when you have, in your garbage and maggots start forming to break down the garbage, like that's what certain strains of bugs, but if you kill them all, like it's very hard for your body. So like we're starting to look at specific strains and start to put people on specific things that they really need and seeing like, faster results than we have in the past. So
Yeah.
that's really exciting too. And, it's always amazed me, even like fecal transplants when people were doing like have severe like ulcerative colitis or something. They get like healthy person's stool, like turkey basted into their rectum and they're freaking healed the next day.
No,
Like,
it's
and
crazy.
it doesn't
Yeah,
always get recreated, but like, what the heck? And same with
I
like
know.
autistic kids that get a fecal transplant and all of a sudden they're talking the next day. Like,
It's
we've got
crazy.
to zone in
I
on the
know.
gut, the gut, the gut. Like, it's
Yeah,
insane.
totally. And I also think, I mean, you're always the first person, and because I am lucky enough to work under you and see what you're doing, but you're always the first person to show me something or make it something that our patients are doing. And then months later, it's like becoming trendy or it's
Yeah.
becoming more something that people are accepting of. And I think that's really important to know too, because like even though everyone might be weary of certain ways to heal, it's showed time and time again through our patients that I just said that I'm lucky enough to experience and see that they are getting better. That's not just me saying that. It's the truth. It's facts. I mean, every single person that you've worked with, Steph, that I've health coached along with is getting good results. And that's incredible because, that doesn't usually happen. And people come and people go all over, they shop all over for different doctors and they're exhausted. You and I both know what that's like, but for people to actually start feeling better is incredible.
Yeah, and we're just always searching for like also like other practitioners in the area, different ways that like we just want to get people better. We're not
Mhm.
trying we're quarterbacking for a lot of people to always find the right thing and then but doing the foundations in the back and doing all of the things that they need. And then we're going to start integrating like small retreats because we just had really good results with someone who was, you know, getting better but not getting over that hump. So just seeing like what's possible even without crazy machinery is really really inspiring to see people getting better and going through it ourselves. And I'm not saying I'm perfect yet, but like what my body went through, what your body went through, like people don't understand the depths of changes that happen with inflammation, with immune system, and like how much and how many years that these things are happening at a subclinical level where you don't really have like really overt symptoms, but like you were in Australia, you didn't realize you kind of felt bad until you felt a bit better,
Right.
right? Like
Yeah.
some people
Yeah.
don't even know
Yeah.
where they're supposed to be functioning from.
Yeah. Exactly. Yeah.
Yeah.
Well, anyways, I mean, I think it's also, there's still a lot to learn about the gut microbiome too. And I
Mhm.
am always interested in trying the best things and trying the new things. And we just started using the activated probiotics for a lot of our
Mhm.
patients, which I've heard really good results from. And I'm actually going to start mine very soon too.
Yeah, I'm excited to see that
Yeah.
moves the needle. Like yours is better, but just not as good as it should be, right?
Right. Of
Yeah.
course. Yeah.
Yeah.
There's still work to be done. I'm
But I remember when I met you and
Yeah.
you were telling me about how constipated you were, and my whole life has been the complete opposite.
Opposite.
Like
Yeah.
I was like incontinence. And then with Lyme, after that, I was like, oh my gosh, Farah, like this is
You
terrible.
get
Like I
it.
can't go to the
Yeah.
bathroom. I was like, what is happening? Like I
Yeah.
even like, you know how they say you're not supposed to drink castor oil, but it helps the smooth muscle contract. Like I was
Yeah.
putting castor oil in my drink to go at one point, and I was like, what? Who am I? Because like I've never had this before, but
And
you know,
meanwhile, I would do that. It wouldn't work.
it did no, it didn't do it.
I
That didn't
know.
actually help that much.
No, it,
I
it
know.
did not help me at all.
Yeah, but honestly, it's awful. Like I don't know, and I was thinking, I don't know what's worse. And then I was like, okay, so before I had all the problems because I was pooping too much, but I didn't have all the other systemic symptoms when I was
Right.
actually getting it out. Like it was a little
Right.
aggressive, but I was like, so it's yeah, like it's very important and a very part of our
Yeah.
mental health to just be able to have regular bowel movements. And
Yeah.
yeah,
And you
yeah.
got to try a bunch of things. I mean, if anyone is struggling with constipation, the truth is I have tried it all. I have done it all. For me personally, bowel mover has been
Oh
really
yeah.
great.
Mhm.
And I still do take it, but I'm going, and that's what
Yeah.
matters. For other people, uh the magnesium O2 has really helped for them.
Mhm.
Aloe has really helped for a lot of people. So you just kind of have to figure out what is your supplement. If you are needing one, what is your thing, and just
And speaking back
rely
to
on
the colonics that you did in the past, like
it.
that's why I'm always so iffy because, I think they're great, but I think, first of all, they do wash away some of the good probiotics, right? So we know we have to
Right.
reinoculate. But I think for some people, especially if there is a Lyme component, but you didn't know, like the nervous system is so sensitive, right?
Mhm.
And the nerves are just everywhere in our along our gut. It's called our enteric nervous system. It's like our second brain. There's more nerve endings in your gut than there are in your spinal cord, right? So
Wow.
that's why it's like your second brain. So then they just get desensitized when they're already, so they needed that push, but then they're like, oh, now I need more, like,
That's
more
exactly
like,
it. That's
hmm
exactly it. My bowels would not even empty. It would just hold in the water and nothing would come out. And
yeah.
even the people that were doing the colonics, sometimes I did the ones that people weren't in the room, and sometimes I did the one that were in the room. And the people that were in the room with me were like, I've never seen this before. Like, why aren't your bowels even emptying the water that's going into it? And that's probably exactly it, because I was so reliant on it. My nervous system in there was just, I don't
They
need
were like
this.
almost like stretched out, like,
Yeah.
like because like they need to be contacting each other. So that's where, there's a fine line, but it can really help detox, especially if you're not going. But I think that there's a big thing of like overdoing it. And even like we don't right away do coffee enemas with people, like, although they're like a great, powerful tool, I do find people that just want to do them all the time once you,
Yeah, of course.
right?
You feel great.
Yeah. So, but like for me, because most of my early life, like, I mean, I couldn't hold an enema for 2 seconds because my
Mhm.
body's was the opposite nervous system of you.
Right.
Mine was evacuating too quickly and yours is
Yeah.
like not, right? So it's a fine line. So yeah, but everyone's different and that's what we do is we try to
Mhm.
cater to who's different and people that have already done enemas in the past that it's really helped them. Of course, we let them, early on kind of incorporate those, but yeah. Yeah. And then sometimes you forget about therapies. But one thing I've been like trying myself lately are like the baking soda baths and like
Uh-huh.
magnesium. Well, I listened to a podcast and I already knew that or it was a talk by one of the doctors for like Desbio, I think. But like they pull out toxins and like radioactive stuff. And because of all the EMF stuff, like, I mean, those are helpful. And even for
Wow.
skin stuff, you know,
Like
I
you
still have
just
the
dump it in a
rashes.
bath?
Pardon?
You just dump some in a bath?
Yeah, like a cup of baking soda
Okay.
in the bath. You can start off lower. It really does pull toxins, and so
Wow.
does like yeah, the Epsom salts even they helped me
Yeah.
so much when I was really bad, but sometimes they can flare you because like they
Oh yeah.
do. Yeah, so you know, there's easy things that you can do at home that aren't costing money because even like all these supplements, they're more and more expensive. Like even
I
at
know.
cost for us to get, they're insane. And then
Yeah.
duties and all of this. So like, you know, ways you can detox, like sauna, like, you know, we do teach people about enemas. Like, I mean, those baths that help you detox.
And
I even,
saunas too sometimes at the beginning for me was
yeah,
awful. I mean, I would go into a sauna, then I wouldn't sleep that night, and the next day I woke up swollen and puffy
yeah,
and I felt really bad. So even
mhm,
that sometimes I know can set people back, and it did for me. But again,
yeah,
that's just your body telling you how much you really do need to detox. But of course, take it slow. It's just there's a lot to work through, and you just have to be patient with yourself.
yeah. And let's talk about that too, because
Yeah.
what happens when you wake up the next day or when you're like hyperstimulated because it's good at detoxing metals. So you start to
Mhm.
mobilize the metals, but then you're not
Mhm.
clearing them. You woke up
Right.
puffy because your lymphatics aren't clearing it. So that's why a
Right.
big part of it that what we talk about with people is okay, first, of course, take a binder before and after, one that you can handle that doesn't make you, or maybe even a liver support, you know,
Mhm.
hydrate a lot. But then we're always telling people to like massage their lymphatics. Like I mean, I'm still not fully back to my normal face, but it's like way less. But I just had so much like congestion. Like, I mean, I had a double D boob at one time on my left side where all the lymph is supposed to drain. It is
Wow.
insane. And
Wow.
that was after an ozone. So
Therapy.
ozone was really hard on me, right? Because they take out your blood, like 500 milliliters, they spin it with ozone, and then they put it back in through a filter. The filter gets out big stuff, but really what happens is, you know, it kills a whole bunch of stuff that was in that blood that they took out. But then, and it pulls some environmental toxins and it reoxygenates, but then your body still has to get rid of it and filter it. And my kidneys were overburdened already, and I just swelled up here like, and my boobs were in so much pain that like I thought they were going to burst. And you know, I'm sure people who've had breastfed have felt that, but I like don't have children at this point.
Right.
So here I was with this cockeyed thing, and then it was releasing all my lymph here. And then I tell this story because it's such an aha moment for me because something I was suffering with was heart palpitations. And when I was massaging here and I actually got some needles of neural therapy here to open up the lymphatics, all of a
Mhm.
sudden I thought I was going to faint. I started having this cluster of heart palpitations, like where I'm feeling like, bah, bah, like they're moving, jolting my body.
Oh
And
my
it
God.
was like a balloon like it went back down to normal, and that was all the toxins having to pass back through my heart.
Wow.
Yeah. So
Wow.
that was my aha moment of, oh my gosh, like the lymphatics, like it was
This
closed
is so,
off. There was a
yeah.
traffic jam. I was suffering. And so, you know, that's why we start castor oil and do like lymph cream or breast oil and open up those pathways. And like
Yeah.
we're massaging the fascia and all of that.
Yeah, and this is another example of exactly what I mean. Again, you've been really on this and pushing our patients and pushing us to really get into the lymphatics and self-massaging and everything. And you are going to be the first person, or I should say, I'm going to be the first person that's hearing it from you. And it's going to become, I know people are knowing about it and they're getting the Brazilian massages and all that, but it is going to become the way to heal because it's helped so much for you. It's helped so much for our patients. And I think that's something that's really important is to like really focus in on that. People
Yeah. And
don't,
we,
people
yeah.
hear that and they're like, really, you massage my armpits
Yeah.
and my chest and think this is going to do anything, but it
It's,
does. It really
it's
does.
It's huge. And we even do it that you're teasing your fascia because we're trying to get the deep lymph. Like we see a lot of like this, you know, people are pulsing like that. That's really
Right.
great for like clearing your skin and stuff, right? Like your superficial lymphatics, but your
Mhm.
superficial has to drain a little bit deeper. Now, if you're backed up, because your lymph has to clear all the inside of your body too, all of your
Yeah. Yeah.
organs. It
Yeah.
has to come up all the way from your legs, everything, and all of it's coming here. So your left side is the most important, right?
Mhm.
Because that's the
Mhm.
most, and that's why my left breast was gigantic. like, I mean, I even had puffiness. I couldn't see my collarbone anymore. And I used to
Right.
have like pronounced collarbones. Like
Yeah.
that's a sign that people have. But sorry, that really the point of the aha moment of the heart palps was, it's physical compression too on the heart, making it
Right.
because I couldn't walk up the stairs at that point. Because think about it, your heart's electric.
Uh-huh.
And now you have mechanical pressure pushing on an electric ball that needs space. Like you
Right.
don't
Of
feel
course.
good,
Yeah.
right? And plus it pushes on your lungs. So like I felt like I could breathe after that. So the mechanical pressure, once you've ruled out if you're having heart stuff, that, there's nothing wrong with your heart, but you're feeling tons of palps and all this. First of all, there's too much waste. There's probably a traffic jam and there's mechanical compression somewhere. And you have to find
Yeah.
someone that knows how to loosen it. Hopefully our course will be ready soon. I just got all the videos sent back. So it's just a matter of putting it together. If someone's listening and they are really good at putting courses together, this is the last piece that we need. But yeah, it was an aha moment. And even like I said, we had someone come here that was kind of like at a stuck point. And what did we do but focus on, we even treated inside the mouth. We treated the big left, like he was blocked all here. And you get resolution of his symptoms of feeling like he was going to faint when he was at camp, and resolution of even the pain in his neck and all of that. The pain kind of is creeping back up because we know we need to remind that area. But like all of these other systemic symptoms have like neutralized. And again, his breathing is better, all of that. So it's like, these are important things. And these are things stopping people from being able to move forward in their
Right.
detox plans, because you get all stuck and then you feel the wired, your face looks puffy, you feel like
Right.
crap, you're not getting good sleeps, you're tired but wired, you're like buzzing, right?
Yeah. Why do you think it is, though, that so many people's, I mean, I know it's kind of a loaded question, but
Mhm.
that is it just because of how toxic our world is that our lymphatics are getting so toxic and stuck? Do you
Well,
think
I
it's
really have never seen this before. And so what you have to do is you have to look at environment, and you have to look at what changed in the last 4 years, 5 years. That's when we've seen
right?
these changes. And so it all comes back to, here's a fact. There was a release of a man-made frequency. We know
Right.
frequencies are healing and we know they're harmful, right? We
Mhm.
know we know that we can watch a movie and we get super stressed out when there's stressful music, or we can get super weepy when other music is playing. Do you know, even sound people understand this? There's sound frequencies, there's
For
frequencies
sure.
we can't hear, but they're affecting our cells, right? Just
Yeah.
like there's sounds that a dog can hear that our ears don't pick up, right? But there's
Yeah.
these frequencies. That's how we're talking right now, through
Yeah.
frequency. We're not close to each other right now. I'm up north, you're there. We're somehow speaking face to face on a computer. That's all through harnessing frequencies. Like
Oh,
these are
that was another
powerful
big,
things.
yeah, that was another big thing was the frequency machine that I
The
used a
right.
lot over the last few years. It was amazing. You have
So
one too.
So we know
Yeah.
that frequencies are like, you can put a frequency in your body that can kill a
Yeah.
parasite, because there's one that a parasite doesn't like, and people are pooping out
Yeah.
parasites without taking anything else.
Yeah.
So why are we not talking about how serious it is to have a man-made direct wave frequency coming at us? All the other
Mhm.
frequencies that exist, they're called scalar waves. Now this is like a laser coming at us all day
Mhm.
long. If you look at the studies of that there are, but no one's talking about, like Dr. Martin Powell, who, gets silenced. I mean, all of the things we're seeing, lower sperm counts, different cancers, brain,
Early menopause.
early menopause, all that. So there's that. Then there's also, I don't know, the fact that there's maybe a tampered with virus that was released. Then everyone was
Mhm.
injected with a DNA fragment of it that makes you make more of the spike protein, which is really damaging. I mean, all of those things combined, and it's a perfect storm. And then people already have stuff in their body, right? So
Mhm.
if you have mold living in your body, but you don't have any symptoms, okay, because your body's kind of coping with it. Maybe it's not so much that it's giving off enough toxins to give you a symptom. But now you get a direct wave coming at you that makes that mold 600 times more toxic. And there's a study where they took mold, they put it on a petri dish, they put it in a Faraday cage. That means it got no bad frequencies coming at it. Then they put it in somewhere where they didn't have any measurements of 5G, and then they put it by a 5G base camp. And the 5G base camp, that mold made 600 times more spores. Spores are the damaging
Wow.
agents. So
Wow.
so that's the other thing is they talk about, oh, but it's safe because 5G can only enter as deep as your skin, right? It goes only millimeters. They're saying so it can't access your organs. Well, here's the thing that they didn't think of. In your skin are your sweat glands. And they're
Uh-huh.
just millimeters. Through
Yep.
your sweat glands, these direct waves are accessing the rest of your body. So they're creating calcium dysregulation, they're causing high ferritin, they're causing any waste you have in your body too, you absorb, you start to attract
Of
more,
course.
right?
I mean, that's like if you put, why are we, why not use toxic lotion then? Like if you're going to tell me it only goes to my skin, well, there's a reason that people are straying
Ugh.
away from
Yeah.
cleaning like detergents and lotions and makeup is because we even going through your skin is toxic enough. So maybe it's
Mhm.
not going directly to my organs, although we
Yeah.
know that it is. It has
Mhm.
to be detoxed through our liver or
Mhm.
has to be detoxed through our kidneys. So that's
Yeah.
completely condescending of
So
what they're trying to say.
yeah, so then now it accesses our body. We already have stealth infections in our body. Almost, not almost, everyone does have them, right? There's
Yeah.
ones that are more accepted as what a stealth pathogen is. So let's think of like herpes, right? So people
Hmm.
who get cold sores,
Hmm.
we accept that you have a latent virus, then you get stressed and like a cold sore comes out, right? But we have
Hmm.
other ones that manifest in different symptom patterns that people aren't catching or understanding. And now
Hmm.
you have all these frequencies, plus you have a virus that totally dysregulates your immune system and your body can't keep up. It can't clear. It's creating too much waste. And so then you get all of these young people that have the most active immune systems sicker than their freaking grandparents half the time,
Right.
like, or
Yeah.
sometimes, right? So it's crazy, but yeah, so I knew that something happened to me that no one ever really uncovered in 2010. And then
Yeah.
I get exposed to this virus plus all this EMF, and then I get all the symptoms back plus, plus, plus. And then I
Right.
finally find out that it was a full-blown acute Lyme infection. Like
Yeah.
when I see most people's, they're in the chronic phase of all of their immune cells. Like
Yeah.
mine were IgM through the roof, in the
Right.
red, screaming at you. I had the textbook case, and it still wasn't accepted by a place in Canada that
By
I
Health
paid.
Canada, right? Like,
Right.
was
But yeah,
yours
no, because
positive on
it's
that?
not, I would not have fit the Western blot because one of their strains that they measure, or like pieces of the Lyme disease that they measure, wouldn't have matched. So
Right.
they're like, you don't have Lyme. I have every symptom of Lyme. This one shows I have a bad infection of it. It's just missing
Mhm.
one thing that you call an important aspect of it, and you're telling me. So then explain to me my clinical symptoms.
Yeah.
Like, like
It
we need
doesn't
to,
make sense. I know.
it's like common
And
sense.
why won't they look at like, why won't they test it the way that these functional testing do, like Vibrant or Armin or
Well, I think
whatever
it's
it
like
is?
it's something like 20 years before research that is going on that is like groundbreaking makes it into like medical school, and then it's an archaic kind of system when it comes to chronic symptoms, especially ones that
Mhm.
aren't immediately life-threatening, right? Lyme is very stealth and very tricky. Like, and you look at
Yeah.
someone's white blood cells, like, and they're mildly elevated for like,
Right.
so it's not like sepsis, you're not going to die
Right.
immediately,
Right.
but you're going to suffer and wish you were dying.
Hmm.
That's
Hmm.
what I felt like. And
Yep.
I've never had that thought in my head, but I was like, I am in excruciating pain. I
Yeah.
have severe anxiety. I have a sense
Hmm.
of impending doom. Like, I'm not having a good time on this earth right now.
Nope.
Like,
I know. You get,
so
honestly, you get depressed. You really do. Of
yeah,
course.
I
But
also look shit, like,
yeah.
and this is a vain world. And like all of a sudden I'm like looking weathered and feeling
Hmm.
terrible,
Yep.
So you're like, what is the point? And so
Yeah.
being able to get people out of that, like, I mean, that's why we do what we do, because I mean, I lost vitality and I was vital before it started. Like, I swear I went from feeling really good to like that. And
Yeah.
so I don't like the blaming of the patient. Like, I'm sorry, there are some outside evil like coming into my
Just
body.
doing this.
Yeah. And you felt it. I felt it. Like, half my face is paralyzed. That was the only time they took me seriously when I went to the
Right.
hospital. Because even when I was bleeding in my bowels, they're like, oh, it's just Campylobacter or something. But, I knew it was something that wasn't going to heal from one round of antibiotics. This was in 2010. It was, just terrible. Anyways, anyone suffering, we're just trying to tell you there's hope.
Yeah, of course.
We really try to walk people through and get them to the other side, but it's
Yeah,
not
and if you're
easy.
feeling discouraged because you're speaking to doctors who are not really diagnosing you or diagnosing you with a certain thing that you, one, don't feel like it is, or two, isn't helping because they're prescribing you to a drug, which has happened to me multiple times, you got to look elsewhere. And someone, whether it's us or somebody else, will find an answer for you.
And, everyone's kind of scared to find answers sometimes, but these things
Mhm.
are already festering in your body. We're just uncovering
Right. What's
what's
going on?
already there.
Yeah.
It's just already there. So you might as well
Yeah.
know what it is, know the evil you're dealing with and get it out.
Yeah,
It's
and even
sometimes
a healthy person who doesn't even think they should be tested or haven't been tested, nobody has a perfect score. I mean, nobody comes back and does these stool tests or these tick-borne tests, whether or not there's tick-borne
yeah.
on it, other stealth infections. People, we're humans, you know, we're supposed to have these things in our body. It's just whether how high it is or whether it's actually affecting you every single day. So I agree with that. Don't be afraid of what the tests are going to say.
Yeah,
Ultimately, it's only going to help you.
yeah, and honestly, this is more empowering than anything because we're telling you that you can heal from your symptoms,
Mhm.
not that there's no way or we just give up on people. Like, we don't give up on people. We will help you and we will keep looking at what could be the possible next step when things aren't working. And I think that's half the battle because these are not easy chronic symptoms to get away.
Yeah.
I started off in this field as someone pretty much working with healthier people, and it was all performance optimization. And I was looking at their gut and uncovering things and helping people perform better. So, like, you can use this as someone who's chronically ill, or you can use this and you can take away roadblocks that are making you not perform as well. And you can add in nutrition that helps you perform better. And you can, support things that you didn't even realize needed supported in this day and age. But I think we all need some support for sure.
Yeah. And I also think that people get very nervous to start a program like this. And the truth of the matter is, we're not asking you to change your lifestyle. We're not asking you to, kind of hide in your house and cook 7 meals, like 7 days a week, your meals, and just be very strict. I mean, of course, there is a large diet component to all this.
Yeah.
There is a little bit of a lifestyle change to this, depending on your lifestyle, of course. But I think people get really nervous about what's going to happen and how scary it's going to be or how they're going to feel with it. Honestly, ultimately, the way that we do our programs are super slow. I mean, you introduce things really slowly. You make sure you're feeling good, and it ends up just being second nature. It ends up being second nature to take your supplements and put on your red light at night or put on your castor oil at night. So I just don't want people to be afraid of what is to come because ultimately you are just healing yourself. Yeah.
Yeah, and we try to meet people where they are. Like, and also it's funny because half the people are doing the most perfect diet. They're doing
Yeah.
like these hacks already, but things
Yeah.
just weren't done in the right order, or you just need a fresh start, new set of eyes, someone to like hold your hand through the dark times. And,
Mhm.
that's what I needed. Even though I'm a practitioner in this field, like I was calling other practitioners, like when I was going through the dark times or, having support
Yeah.
from, because again, it's not easy to go through these symptoms that seem to like pop up
Feel
in all different
feel
places
alone.
in your body.
Right.
Yeah.
Yeah.
Yeah. Well, thank you so much for all that you do for our patients at Vegas
No,
and
thank
for
you.
sharing your story as well,
Of
because
course.
it's never easy. We've been planning to do these things for a long time, but yeah, thank you so much for being
Of
open,
course.
honest, and
If I help anyone, then that's the
yeah,
best. I mean, that's really why we do what we do, even just for someone to feel resonated with or yeah, like my story was similar to theirs. I'm here,
yeah.
so reach out.
Yes. Thank you again. Thank you so much for your time. And I hope everyone
Thank
enjoyed
you.
this.